session will be recorded for quality control purposes, as well as for the other people who aren't on the call. And as usual, try to identify yourself by saving your device with your name and your country, and you can use the chat function to speak. You can use the chat function to speak, to leave messages or questions, and also you can raise your hand using the raise your hand option. So we'll start off today. We already have about 8 people on the call. We are hoping that other people can join. And as usual, we'll start off with introduction. Agenda for today, we have introduction, EP updates. We'll have updates of the interaction review for COVID-19 conducted in Malawi and Zimbabwe. Well, planned to be conducted in Malawi and already done in Zimbabwe. And we'll have a presentation on what's happening around COVID-19 vaccine. So we'll just start off with introduction. My name is Ezino Mwekwe, a public health officer at the Regional Collaboratory Center of Africa CDC. I could just call out your names as I see it here. There is Maria. Maria, can you introduce yourself, please? Hello, Maria.
Okay, good afternoon, everyone.
Yeah, we can hear you. Your name, what you do, and which country?
Okay, Maria Gabriel, a field epidemiologist.
Maria? Okay, so Maria seems to have dropped off, but she says she's a field epidemiologist from Namibia. I think one of our volunteers in Namibia. There is a Nyambe. Is that Dr. Nyambe? Can you introduce yourself, please?
Working from.
Good afternoon, Dr. Nyambe from Zambia National Public Health Institute.
Okay, great. Thank you very much. There is Etha Haludilu. It says Namibia FLTP. Hello.
Yeah, good afternoon, everyone. My name is Erta Haludulu. I'm field epidemiologist from Namibia.
Okay, thank you very much, Etha. There is Ario Bakare.
Good afternoon. My name is Bakari, Africa CDC.
What do you do in Africa CDC?
I'm the IPC focal point, Southern African region.
Okay, thank you very much.
Nice to see you all on the call.
And there's Dr. Hamonga, Zambia.
Good afternoon, everyone. Good afternoon, Ezine. I'm Dr. Raymond Hamonga with the Zambia National Public Health Institute. I'm an epidemiologist. I'm also with the
I think we lost Dr. Hamonga. Okay, so we can move on. There are more people. There is Patrick Sakobita.
Communications, Information, and Research.
Okay, thank you very much, Dr. Hamonga. There is Patrick Sakobita.
Oh, yeah. Yes, my name's Patrick Sakobita, field epidemiologist, based at the Zambia National Public Health Institute in Zambia.
Okay, thank you very much. There's John Simwanza.
Yes, I'm Dr. John Simwanza, field epidemiologist, currently based at the Zambia National Public Health Institute.
All right, thanks a lot. There is Reshma. Reshma, could you introduce yourself?
Thank you, Madam Chair. My name is Reshma Misra. I'm the Assistant Director for Infection Prevention and Control in the province of KwaZulu-Natal in South Africa. Thank you.
Thank you so much, Reshma. Great to have you on the call today. Then we have Tebelo Kolebe. I'm sorry if I didn't pronounce that well.
Thank you. I'm Tebelo Kolebe from Lesotho in the Ministry of Health and the WASH program, but I'm also in the IPC National Committee.
Okay, great. And is there anyone else who've missed out? Henry Nyaka.
Yeah, I'm Henry Nyaka, risk communication support, Malawi.
Oh, great, thank you. I hope we'll have a big representation from Malawi today like the last time. Then we have Akat Therodi.
Hello, good afternoon.
Is Asante, the project.
You can go
Hello.
ahead. Yes, we can hear you.
How are you?
Very good. Could you introduce yourself and your country and what you do?
Okay. Oh, thank you. My name is Augustine Castrodi.
Okay.
I'm an infection control practitioner at national level, Namibia.
Yes, you just called me. Nice to have you on the call. So we'll have other people who I can recognize. I could just introduce them so that we can get off. We have Watipaso from Malawi, who is in the lab. We have Dr. Owen Musupoli, who is in charge of IPC in Malawi. If I'm wrong, please correct me, but I think I recognize this ones. So that we can move on. And Lucius, could you introduce yourself, please, or name yourself accordingly?
All right, thank you so much. Lucius Chabuka, laboratory expert, CDC Africa volunteer, Malawi.
Oh, okay, as well, Malawi again. All right, thank you very much, everyone. So we can move on quickly as more people join. Just do me a favor, kindly drop your email address in the chat function, your name and email address in the chat function, so that we can follow up. We can send resources via email to you after the training. There's a Paida that joined. Paida, which country are you from? And can you introduce yourself? Paida? Okay, we have a lot to discuss today, so we can just move along. Please kindly drop your details in the chat function. Email and phone number if this is your first time of joining us. So we'll just start quickly with the epidemiological updates very quickly. As at today, okay, so the EPI updates as at today stands as follows. So globally we have, globally we have, as at today, we have more than 33 million cases confirmed with a CFR of 3% globally. Just a moment, I need to minimize this. Okay. All right. Great. So I'm just going to start all over again. So globally, we have more than 33 million confirmed cases. We've crossed the 1 million mark when it comes to deaths. And we are standing at a CFR of 3%. And from the EPI curve, you can see the different regions. Africa is still the least, that's in red. And then followed by EMRO region. And then the Euro region, the WAPRO region, and then the highest is recorded in the Sierra region. So that's how it stands globally. And as we can see from the maps, that Africa still has the least number of cases as a region. South Africa is the only country in Africa that is recording. South Africa, Nigeria. South Africa is the only one recording more than 500,000 cases. Nigeria, Egypt, Libya are the ones recording between 50,000 and 300,000 cases. The most countries with the most cases remain the United States, India, and the Asian countries. Then if we come down to Africa, we can see how the epi curve is. Using a 7-day moving average, it appears to have peaked around July, August, and we're gradually beginning to see a downward trend in cases. So in Africa, we are more than 1.4 million cases with 35,000 deaths and a CFR of 2.4, which is lower than that of the global. And it's 2% of our cases have recovered, which is quite impressive. And in terms of region, we could see that the northern region is the region that still has the most cases, and then southern, and then western, and then and so on and so forth. So it's better broken down clearer here, where we have the countries. Sorry. So where we have the continents broken into regions, with the northern region having the highest CFR, which is even greater than that of the global, which is 3, but our northern region has 3.3%, and southern is second, majorly because of the high volume from South Africa, which is 2.4, and then followed by eastern, central, and western reporting the lowest CFR. And in terms of deaths, southern has recorded the most number of deaths, followed by northern. And the same follows with the cases and the recoveries as well. The highest number of cases are from the southern region, followed by northern, then western, eastern, and central regions. Then according to how the continents is doing, these are how the countries fare according to the number of cases they have. Only one country, which is South Africa, has more than 50,000, is reporting more than 500,000 cases. 5 countries are between 50 to 500,000, and the others are like that. So you can identify your country from the map and where you fall into. So most of the countries in our region, apart from Zambia and Angola, which are between 10,000 to 50,000 cases, and then South Africa, that is more than 500,000, are all less than 10,000 cases. So that's just about that, just to give us just a broad overview of how it is on the continent. So that wraps up that session, unless anyone has any questions. We can move on to the next phase of the presentation. Any question? So we've had more people joining while we're waiting for questions. We've had more people joining. There is Annie Mwale from Malawi, Danis Nyange from Zambia, Tandai Chipendo from Zimbabwe, Nenia Langa from Zambia. Sabang, I am not quite sure. Could you introduce yourself and tell us which country you're from?
Thank you so much. My name is Tabang Masang. I'm from Eswatini, and I think this is the second or third time I joined this forum, and I appreciate. And thank you for the presentation and the updates on the COVID-19 pandemic. So thank you so much. I appreciate it.
Great to have Eswatini back on the call. It's been a while. Can you just drop your email address in the chat box? And Paida, could you introduce yourself and the country you're coming from?
Good afternoon, everyone. My name is Dr. Paida Manduzo. I'm from Namibia. I'm representing the Africa CDC volunteer group from Namibia.
Oh, great. Thank you very much, Paida. Great to have quite a very rich representation today, and some countries we haven't seen in a while, like Lesotho and Eswatini are back on board. Thank you, and I hope you're going to be more constant now. So just drop your emails in the chat function, and we can follow you up and send you emails and reminders of the next meetings. So as you're aware, the ECO call holds every other Wednesday. The same link for the Southern African region, and what we do is to share information. For the past about 6 months now, we've been sharing information on COVID-19 because that's what's on board. But we will, after this session, start thinking about going back to our usual way of discussing other diseases apart from COVID, as countries are beginning to open, and definitely we know that life has to go on, and the other diseases aren't waiting because there is COVID. So we also need to prepare accordingly. So as for our agenda today, the next thing is updates on interaction review from Malawi and Zambia. The last ECO call we had, Zambia told us they were planning for an interaction review last week. Malawi mentioned that they are preparing for an interaction review. So we'll hand over to the team from Zambia to give us an update of how it went and what lessons can other countries draw from your experience. And maybe also, this will also encourage other countries in the region to think about conducting the interaction review. So Dr. Ray, the floor is yours.
Thank you very much again once more, Ms. Ezine, for the opportunity to share on this platform. As introduced earlier on, I'm Dr. Raymond Hamonga, coming from the Zambia National Public Health Institute. And Zambia has responded to the COVID-19 outbreak by use of an incident management system. And this one is housed under the Zambia National Public Health Institute, FIOC, the Public Health Emergency Operating Center. And under the IMS, I do serve as the Planning Section Chief. So with regards to the Intra Action Review, this is an event that was organized by the FIOC and the IMS under the ZNPHI.
Dr. Raymond,
and our purpose was that we would sub-national COVID-19 response. Yep.
Oh.
Sorry?
We lost you for a moment, but you're back now.
Okay. I hope I'm audible right now.
Yes, you are.
Okay. So I was saying the interaction review for Zambia has been organized by the IMS, which is the Incident Management System under the ZNPHI Public Health Emergency Operating Center, the FIOC. And the purpose of the interaction review for us was to conduct a review of the national and sub-national COVID-19 response so as not to miss critical opportunities for learning and improvement. And this activity was very much country-led. The chairperson for the activity was the FIOC manager, Dr. Nathan Kapata, and he co-chaired this with the lead on the partner side, WHO, Dr. Shikanga, who's an epidemiologist with the WHO here in Zambia. And in terms of how we structured our interaction review, we condensed the response into about six main pillars. These being coordination, planning, and monitoring, risk communication and community engagement, surveillance, points of entry, laboratory and maintenance of essential health services, IPC And last but not the least, operations and logistics. Now, as indicated, we had our interaction review last week, and therefore this week we are compiling the reports from the various sessions. We ran our interaction review for 3 days, and we had at least a cluster going in the morning and another group going in the afternoon. And these activities were held, we had a few people attending in person, and a large number of our partners joined in virtually on the call. And the outputs and the rapporteurs are working on the report and generating a report which we can share in a more comprehensive way probably on the next call. But however, I'll just briefly highlight some of the preliminary results that came out of that interaction. So the discussions were in terms of partners as well as the session. The stakeholders did share and have discussions on what could have gone right, what went well, what would have been done better, and way forwards. One thing that came out of it is that we were able to be completely honest with each other, to see areas that we can improve with regards to transparency, with regards to avoiding duplication of efforts in the response, and also with just generally educating each other on how the incident management system is supposed to work and is expected of it to work. So by the end of this week, we'll have a full report, comprehensive reports of all the minutes and the way forwards that have been, that were discussed at the interaction review, and we'll be happy to share that with the rest of our sister countries. And for countries that may not have yet had an opportunity to go into interaction review, we would encourage that to take place. I think the earlier the better, to put a stop to some of the areas that could be, you may not realize that could be hurdles, but could be posing as hurdles based on maybe a few communication areas. We also learned that we need to talk and continuously talk with each other to ensure that we remain on the same page, to ensure that we clear any frustrations that will be ongoing, and ensure that the response is indeed a timely one and free of any bureaucracy tendencies. So that is exactly where we are with the interaction review. It was the first time we did this. We always do after action reviews, but for an interaction review, it was worth undertaking as a country. I submit, Madam Chairperson.
Thank you very much, Dr. Ray. That's very, surely could be comprehensive, and we'll be waiting for your findings during the next ECHO meeting. If there's any question for Zambia, kindly just put it down in the chat. We'll listen to Malawi and then we'll take all the questions together. So, Annie Mwale, can you give us an update for Malawi? Annie?
Yes, Zini, just a minute. Can I share my screen?
Sure, you can. Let me just okay that. Yes, you can.
Okay, it was saying it's disabled for participants. Okay, I can now. Thank you. Okay, good afternoon, everyone. So I'll briefly present on our preparations for the interaction review. We started working on this, I think, about 2 weeks ago, and we're just finalizing our concept notes that were requested to present on what we've done so far, how are we going to conduct our IAR, so that we can get some comments and maybe other countries can also learn from there. So this is the outline of the short presentation. In terms of the pandemic update, so Malawi as a country, we started preparing in January of 2020 when it was declared a public health emergency of international concern. And we devised a plan that was going to run from January to June. And when we started getting cases in Africa, when WHO declared it a pandemic on the 11th of March, it was actually declared a disaster in Malawi on the 20th of March. For our first cases, we had the first case confirmed on the 2nd of April, and then on the same day, we also confirmed 2 more cases from the contacts of this case. And since then, we responded to the outbreak, started seeing an increase in the number of cases between May and July, and we peaked in July. And from August to date, we have been seeing a steady decline in the number of cases that we're recording on a daily basis, as well as the admissions and deaths. So this is how our curve looks as a country. As I mentioned, we peaked in July, and since I've been recording fewer cases from early August to date. So we decided that we needed to do an interaction review at this point, mainly because we've now noticed this decline in the number of cases, and we feel this is a point at which we need to look at what we have done so far, and then share experiences in terms of the response, and also document what worked for us, what didn't work so well, so that as we are preparing for any possible next wave of the outbreak, we should already know what has been working, so that we institutionalize it. And for the gaps that we need to identify in terms of our response, we should be able to already have possible solutions, and then be able to develop some interventions and plans for these. So this is why we're doing the IAR today. At this point. So in terms of what tools we have been using for the development of the concept notes. So WHO Afro has provided, I'm sure all countries have received this information, has provided the template for the concept notes. They also have a facilitator's manual, and some generic trigger questions that will be used for the IAR. So using the template, we've managed to fill it and input the various sections that we're going to look at in terms of our IAR. And we have also already gathered our response plan, the January to June, as well as our revised response plan, and looked at it to see which areas we need to work on, and also depending on looking at the various policies, guidelines, activities that we did. We also right now in the process of gathering all the various work documents, guidelines, policies, so that we should be able to use these as we are doing the review for the response. For the scope, we are doing a national level review at the moment. And then, of course, being the national level, most of the implementation is actually at the district level. That is our subnational level. So we will still incorporate the areas or complements of the district level because of the implementation. But then for specific district plans and response at specific districts, the interaction review will be cascaded down to this subnational level, depending on how the national level goes and as we see it fit or appropriate for it to do so. So for the response pillars, for the response, the way Malawi's response was organized is that we used, since it was declared a disaster, we used the Department of Disaster Management system for managing disasters, and they have several clusters that within their coordination for them to be able to respond to disaster. So as health, we fall within the health cluster, and out of this, the health cluster, we have the pillars that I've listed that we're going to review in the interaction review. But because we were responding in a multi-sectoral manner, and because they were responding to it as a disaster, we also have these other clusters that we are going to look at in terms of reviewing how we've managed to respond to the COVID-19 so far. So of particular interest, of course, is the security cluster for enforcement, the social protection, the WASH cluster, and we'll also just get brief reviews of the other clusters. That's why I put they're under consideration as to whether we're going to indeed incorporate all of them to manage to do that in the period that we have. So we're going to do it as an on-site review, and of course it's being led by the COVID-19 Emergency Operations Center committee. And we're working with the WHO as well as other partners, but mainly for the development at this stage, we are working with the WHO counterparts. And of course, it will be interactive, structured. We will use the trigger questions that have been provided. So the way we are going to do it is that we will do it in 4 stages. The first stage would be a preparatory workshop where we'll get all the pillar leads and orient them on the objectives of the IAR and what the expected outputs are. And then the pillar leads will after that, meet with the various focal points in the pillar and to review that section before coming to the main workshop, which will now involve everyone. And then this is where we will have the facilitators guiding the discussion, asking the questions, and coming up with the root cause analysis for the various gaps that we identify. And then from there, we will have a dissemination now for each of the pillars, a small presentation that will be presented to senior management for both the ministry as well as our implementing partners in the COVID response. So then from there on, we'll get an endorsement and consolidation, and then incorporate all the various activities or actions that we come up with into the response plan, so that we're able to respond better as we proceed. So yeah, for the next steps, we are going to submit the concept note to WHO, who are going to fund the activity as well. So there is that resource available for member states that WHO is able to support financially as well as technically. And then, of course, we notify all our stakeholders, and then continue with the gathering the document reviews for the pillar leads. Thank you very much, and that's the end of my presentation.
Thank you so much, Annie and Malawi, for a very, very detailed presentation. Is there any question now for Zambia and Malawi? Based on their presentation, Zambia has conducted theirs. Malawi is, we've seen 2 sites, Zambia has conducted, and Malawi is planning to conduct theirs. So do you have any questions, any additional comments, any contributions, any suggestions for these 2 presentations we've received? You can raise your hand. There is a raise your hand function at the bottom of your screen. Any question? Or was it really so clear and complete that we don't have anything else to add? Silence. Okay, so we'll take that there isn't any question for them. So if, as we go along, you have any question, please, let me check the chat function. Please drop your questions. And also don't forget to leave, if this is your first time, please drop your email address on the chat box. So we'll just move along today. For the next section, I just want to give us a brief overview of this, how, because the next phase, everyone keeps asking that question of the vaccines, what are we going to do about the vaccines, what's happening, and where does Africa stand when it comes to the vaccines. So we just thought to share a brief presentation, also given that Africa CDC is, oh my, I don't know what happened to my laptop. So given that Africa CDC is also planning something to this regard, my slide isn't working. Just a moment. Okay. So I guess you all can see my screen. So it's just going to be a very quick update. So just looking at what's happening on the vaccine landscape and how Africa stands to benefit from it all. So just a general overview, there is a, WHO keeps like a directory of all the candidate vaccines, whether those in clinical evaluation and those in preclinical evaluation. So that's the COVID-19 vaccine landscape. So it's updated very often. And this is a sample of what it looks like. So there is all that detail given, and as at now, we have 40 candidate vaccines in clinical evaluation and about 151 in preclinical. And it's important to note that some African countries are actually, Egypt actually has some candidate vaccines undergoing preclinical trials now, that if that passes, then they can now be tried clinically. But thus far, we have 40 being evaluated as at the moment. So just a brief overview of what's happened recently in the vaccine sphere. We know the AstraZeneca funded vaccine trial by the ChAdOx COVID vaccine that it's been also funded by AstraZeneca that was voluntarily paused. So this has resumed, and this is the only vaccine trial that is also being tried, the new vaccine that's also being tried in Africa, in South Africa, and they're actually recruiting in Kenya. So it was stopped because a patient had experienced some symptoms, and after reviewing the data, it continued in the UK, Brazil, and South Africa has also continued theirs. The Kenyan will start when they are done with getting volunteers. Then another one is just debate about the China-based Sinovac. That was the one that China had sped up and actually okayed and given the go-ahead. They had reported their data for the phase 1 and phase 2, and they're currently doing their phase 3. But this vaccine has already started, it's already being used in China by the military only. And also they want to start vaccine trial for younger people, that is people between the age of 3 and 17. So then another one, new vaccines that are getting into phase 3, one is the Ensemble trial. And this Ensemble trial is going to also be carried out in South Africa. So it's by Johnson & Johnson. So it's going to be targeted at 12,000 volunteers across 30 sites in South Africa. So they are the ones who they are the ones who had, remember the Ebola vaccine that was approved? It's still the same people that so they're trying to leverage on their technological platform to be able to work on the COVID-19 vaccine. Then something else we want to just mention is that people are also looking at having intranasal spray vaccines. So that's being looked at in China as well. And also Imperial College London is trying to see how they can, this Oxford Chadox 1 nCoV vaccine, to see if it can also be delivered orally as aerosols through a nebulizer. So those are the key things in terms of vaccine that is going on. But then in Africa, we've had some impressive things also going on, some key clinical trials we can just look at in Africa. So one is in Egypt, the prophylactic ivermectin clinical trial has been completed, and then there's the results have been published, and we can also check that. In Tunisia, they've had 3 registered clinical trials, all still same on the hydroxychloroquine. Those were withdrawn actually, given that there's a lot of controversy around hydroxychloroquine. And interestingly, most of the clinical trials in Africa are around hydroxychloroquine. And these are the first ones that are now being withdrawn, and maybe others may follow suit. Then for immunotherapy trials, we can look at Makerere University in Uganda had just registered a COVID open label randomized clinical trial to look at the safety and efficacy of convalescent plasma for treatment of adults in COVID-19 in Uganda. So those are the key things, the key clinical trials that are happening in Africa. So another question we're asking is, what now happens when there is a vaccine? Where does Africa stand? So globally, there's been an establishment of a COVID-19 vaccine global access facility, that's a COVAX facility, and thus far 172 countries have gotten on board, and they are collaborating with various vaccine candidates. So this COVAX facility is leveraging on, it's led by Gavi. You know, Gavi is the vaccine global people, and in collaboration with WHO and CEPI. So the aim of these COVAX is to accelerate the development and manufacturing of COVID-19 vaccines and make sure that every country in the world gets the vaccines when it is available. So we have 9 vaccines are being supported by this initiative, and there are further 9 candidates that are under evaluation, and procurement conversations are ongoing to make sure that when these are finally out, everyone can get at least a piece of it. So there are about 80 countries that are self-financing, that have submitted their interests. And then these are joining 92 low and middle income countries, which are most of the countries in Africa that are eligible to be supported. So the idea is that when a vaccine is ready, that there'll be doses for at least 20% of the population of the country is involved, all 172 countries. So we'll be able to deliver, since there's a joint collaboration, there's a push that these vaccines are going to be delivered as soon as they're available. We'll be able to also manage there are already 9 that are being supported, an additional 9 that are going to come on board. So that means that we have a variety, and it's going to be sped up. At least there's going to be, since there's that joint collaboration of funds, it's going to be possible for these vaccines to be available as soon as possible. And then in Africa, that is globally, in Africa in June, Africa CDC had the COVID-19 Vaccine Development and Access Virtual Conference. This was in collaboration with WHO, African Vaccine Regulatory Forum, as well as other stakeholders. And the idea was to come together to discuss and strengthen capacity to adopt and scale up a vaccine for COVID-19 once there is one available. So the collaboration will work at securing sufficient vaccine supply for African countries and also removing all barriers to vaccine rollout. So this was the first conversation that was had on the continent on vaccines. And following this, Africa CDC with key partners are currently finalizing on a continental COVID-19 vaccine strategy. And WHO has also established a working group on immunization in anticipation for COVID-19 vaccine. So as you can see that there are quite, the conversation has come down to Africa, and with time, once this strategy is finalized, we'll definitely let countries know how we plan to move forward should a viable vaccine candidate be approved. So that's just all from me. I just wanted us to have an idea that yes, the continent is also on par with the discussions that are being had around the vaccine, and whenever this vaccine gets available, we are also leveraging to make sure that countries on the continent also get the vaccines as soon as possible. So that's all from me. If there is any question, you can answer. So I can just look at the chat function. You can raise your hand if you have any questions or drop questions in the chat function. So there is a question from Dr. Owen Mosopole from Malawi. He said, do we have some countries that have done some studies on antibodies to check on herd immunity at this point? For me, I'm not aware of any. I could be mistaken, but I don't think any country has done such on the continent. All I know that is going on are several prevalence surveys to find out the extent of infection in countries. So that's all I know that is ongoing, but I don't know about studies on antibodies to check on herd immunity. If any of your countries here, we have 7 countries in the region, so if your country has done this, maybe you can just speak up and we all can learn from what your country has done. But for me, I haven't heard of any country. So I've been talking a lot, so I need someone to actually say something right now. Or a question, comments, contributions from anyone. Patrick, do you have anything to add?
Thank you, Ezini. No, nothing. Great presentation. Following.
Okay, so Dr. Owen has his hand raised. You can unmute yourself and speak, Dr. Owen.
No, thank you so much, and thank you for great updates. I'm really, I was really asking about antibody testing. I've heard so many other colleagues thinking that probably with a lot of local transmissions and around, it could be possible that a lot of us got infected and others really are developing some immune to the virus. So I really wanted to hear if other countries have really moved ahead to do those sero studies to check what's the level of the immune that communities have built, or even if it means among healthcare workers. We have seen now that the figures, the statistics are going down, and we not sure as the countries are really opening up, when would we anticipate maybe a second wave, as other countries up there are experiencing some second wave of the pandemic. Thank you, Ezin.
Yeah, okay, so I have someone from Namibia who said no, that their country hasn't done any. So if your country has done that, what all I'm aware of that countries are doing and Africa CDC is supporting is the seroprevalence surveys that we are piloting in 5 countries in the region, but that's really is to check really the extent of infections in the country. So as for the studies on antibodies for herd immunity, I don't think any country in Africa has done that. So is there any other contribution, questions? Before we go to the last thing, today is really packed, I know, but then we just quickly have the last thing and then we can go. So if there is none, I mean, I would like some feedback to know that we're together. Really, that will help. Even if it's just to say, no, your country hasn't done any of such studies, you can drop that in the chat function like Namibia has done. And at least we can know that, oh, maybe 7 countries, we are sure that 7 countries haven't.
Hi, Ezine. Ray here again.
Yes.
Yeah, I think I wanted just to speak a little broadly in line with the question asked by my colleague from Malawi, Mr. Musopole. Yes, Dr. Owen Musopole. Yeah, in as much as we haven't done specific targeting, focusing on herd immunity, like you rightly indicated, we've done seroprevalence studies. And for Zambia, we did that in our at-risk districts. So the districts where we knew that we had high number of cases reported, and we targeted those ones for our seroprevalence study. And in a way, what that tried to inform us was to have an estimate of, as you may be aware, that we all have quite low testing rates on the continent as a whole. South Africa is probably leading us in terms of testing rates, but generally we do have low testing rates. And the idea was for us to see what could be the numbers of cases out there and just have an estimate of what numbers we could have missed.
Dr. Ray, you've dropped again.
Based on the sampling that we preliminary work, but the study. So this is still preliminary work, and the study led by Professor Mlenga, though preliminary, did have estimates of the numbers that could have been positive, but did not really present in our facilities. And in that regard, we've decided to do also now a national prevalence survey study to see people who could have who could test positive based on the antibodies in their blood, and those against those who could be positive based on the testing rates. So not to answer your question directly, but that's some of the work that we've done in Zambia. And this week we are actually doing the training of data collectors and also who actually go into the field to collect the data in all the 10 provinces of Zambia. So in a way that will inform us on the seroprevalence and also speak to what estimations we could have around whether maybe we do have herd immunity or not. I just hope that helps in response to your question, Doc. Thank you.
Yeah, thank you so much, Dr. Ray. So interestingly, next week we are hoping to have our senior officer in charge of biosecurity, biosafety, Dr. Tokmo Maruta. He's going to give a presentation on this seroprevalence because he's the one coordinating it for the region. So it would be nice because I think it will answer some of these questions that we are asking about. Why is it such that we're expecting during the cold season, Africa should have been hit so badly? Maybe that presentation, all of that, he will discuss in that presentation next 2 weeks. So if there's no contribution, I just want to go quickly to this. Like I said at the beginning, for 6 months now, we have been talking COVID, sharing experiences, which has been amazing. I'm sure we've learned one or two things from other countries around us, and who has also had similar experiences with us, so like we've had. So I just want to, just for us to take a moment to, okay, this is a bit all over the place. Just to take a moment to look at a few topics that we could all benefit from as we are okay. So I've just listed a few areas of interest. At the beginning of the year, we had a 2020 plan, but then COVID happened. And as you're aware that all our focus has revolved towards COVID, but then we can still discuss COVID alongside other things. So I have just listed a few things from my thoughts and what we have to offer as Africa CDC. And I'm hoping I could get some more inputs from those of us on the call as to other things we can add on to this. So please, you could just look at this. If there are other things, it mustn't be COVID centered, but it could be something else you feel your country can benefit from. Just please drop the topic in the chat function, and I will check that out. So one is the seroprevalence survey that I mentioned, that we'll have someone present on tomorrow, on next 2 weeks, which will be our next meeting. We'll look at that because we are pushing for countries to do that, and also for us to see what countries stand to benefit if they conduct seroprevalence surveys, like Zambia has just mentioned. That can give you some insight into some things we can see, and also give us data to plan ahead. So that's going to happen first. But then the other thing is Civil Lives, Economies and Livelihood Campaign of Africa CDC. You know that we are moving into a second phase of the outbreak now, where countries are opening up, we're trying to open economies, but then we need to make sure that people are safe. So that will be focusing, we'll have a session that will be launched. There's some apps that are being launched alongside this campaign. So we'll have a session to really share with member states what that's about. And then mortality survey is also another area that we feel we can explore with countries, and to see which countries are doing this and how they're doing it, what they have, what the data has shown them, and how other countries can get on board. And then looking at the role of antimicrobial stewardship programs in COVID-19 response. As you're aware, a lot of antibiotics have been touted and used in the treatment of COVID. So how have our stewardship programs, antimicrobial stewardship programs, played in this area? Then I'll beam the plan we had initially, but then another one is the AFTCO. AFTCO is the Africa Task Force for COVID-19 response. there's a laboratory guardians dissemination program that we're having in collaboration with Results to Save Lives. So those topics there are the areas that they want to have subject matter experts discuss with member states. So this is these are my our proposals from Africa CDC. If you have additional things to add, please just drop in a chat function. This is for us, this is not for me to just talk about. You can mention it, you can drop in a chat function. We just have maybe 2-3 minutes and we can wrap up and call it a day till next 2 weeks. So any contribution to this, even if it's just to say, yes, yes, I like this topic, I like that topic, that will help.
Thank you, Doc. This is Tabang again.
Yes, please.
I think I appreciate the presentation, sharing through the email addresses as you did in other presentations.
Yeah, I'll do that. So any addition to the proposed programs, proposed topics for subsequent meetings? Reshma says, thank you, topics look good, that's feedback. Thank you very much, Reshma. Anything anyone wants to add to, okay, to say, no, we shouldn't focus on this, let's focus on the other one for the region? Because one of the key reasons why we set this up is to also learn, to build capacity, to strengthen our systems, to share information. So we want to make sure that what we are sharing benefits the member states. Okay, Paida says interested in number 3, that's the mortality survey, looking forward to that one. Lovely. Paida, what country are you from? You didn't introduce yourself. Did you introduce yourself? Namibia. Okay, Namibia. Great. So maybe after the presentation, we could see if we could do a mortality survey, support a mortality survey in Namibia. More contributions, 1 more minute, and we'll call it a day. Okay, so I think that's it. Thank you everyone who has joined us today. I will send out the presentations we've made today via email to everyone. And we have, if I got your emails in the chat function. So thank you so much for joining us for another session. It was quite interesting. Thank you to Zambia and Malawi for your presentations. We've learned quite some from it. And we'll see you next 2 weeks. Have a lovely Wednesday afternoon. Bye.
Thank you. Bye.
Thank you. Bye, Azane.
Bye.
Thank you. Bye.
Thank you. Bye-bye.
Thank you. Bye, everyone.
Bye. Hilda Barra, you're just joining us. Can you drop your email in the chat function and your country? And Google Maps.
Okay, thank you.
Thank you for joining us today, Google. Thanks, Hilda. Mr. Augustine from Namibia. Augustine? Hi.